Arteritic Anterior Ischemic Optic Neuropathy, or NA-AION, is a relatively common condition that affects people's optic nerves. This is a vascular condition, so what happens is there's a compromise of blood flow to the optic nerve. And this condition is typically more common in people who are 70 and older, although it can occur earlier on in life. There are some very well-known risk factors for this condition, although it can occur even in absence of these risk factors. The most common risk factors happen to be anything that causes damage to other blood vessels in your body. Those would include high blood pressure, diabetes, sleep apnea, high cholesterol, and smoking. What typically happens with this condition is once that blood flow is compromised, you have damage to your optic nerve. It's almost in essence like a little mini stroke to your optic nerve. It's not really a condition in the brain, but to the optic nerve itself. What the patient may notice is a sudden, painless, and that's very important, it's a painless process, decrease in your vision. And this can range from anything to a small decrease in vision to a very drastic decrease in your vision. Oftentimes what you'll see is a particular pattern where you lose half of your vision, either the top or the bottom half. And we do what's called a visual field test where you can actually show this. And I have one slide to actually demonstrate what it looks like on a visual field when you have half of your vision lost. Now the black part in this slide shows what the patient cannot see. So when the patient comes in for an examination, typically what they say to me is, "Doc, I've lost some vision in my eye and it was really sudden." Usually happens when you wake up. It kind of happens overnight and you develop this when you wake up in the morning. On their examination, what you're going to see is that they're probably not seeing as well as they do out of the other eye. The other thing you're going to notice is that their pupil doesn't react like the other eye does as well. Once you dilate the eye, you're going to see physically that the optic nerve is swollen. And here's a picture of what that optic nerve actually looks like. You can see tiny little hemorrhages around the optic nerve, and that's an indication that there's been some damage to the optic nerve. Now, the good thing about this condition is that it's not progressive. This is not something that's likely to lead to blindness. Typically what happens is over the next several months, you may see some improvement. Now, unfortunately, there's not really a good treatment for this condition. There's some evidence that says that using steroids is useful, but oftentimes you don't see a whole lot of improvement with the steroids. What I tend to tell my patients at this point is that the best thing that you can do for yourself is to look at your risk factors. If you have high blood pressure or diabetes or sleep apnea, those things need to be managed because this is an indication that you may be having blood vessel damage elsewhere in your body. So once you manage those things, and I usually do that in combination with their primary care doctor, that kind of gets them on the path to being healthier overall. This is not a hereditary condition, it's actually very sporadic. Typically, once you have damage to your optic nerve, you may get improvement in your vision, but a lot of times the damage itself is permanent. However, I wouldn't consider this a chronic condition because it doesn't progress over time. This is a very common condition. Typically in my clinic, I'll see maybe 5 to 10 patients a day that have this condition. When I diagnose this in a patient, this kind of prompts me to talk to them about their risk factors and get in touch with their primary care doctor. It really prompts them to work on their blood pressure, their diabetes, and other things that may be a risk factor for this condition. Now, we were talking about non-arteritic anterior ischemic optic neuropathy, and I think it's really important to draw the comparison to an arteritic anterior ischemic optic neuropathy. Now, with an arteritic form of this condition, you actually have inflammation of the artery supplying blood to your eye. And this is a completely different condition. This is otherwise known as giant cell arteritis or temporal arteritis, and the presentation is drastically different. What you'll see in this case is a severe decrease in vision, which is oftentimes blinding, usually associated with severe pain, sometimes fever, night sweats, and other things that are more systemic in nature. This condition will require a little bit more workup than a non-arteritic form. Blood tests need to be drawn to check on inflammatory markers in your bloodstream. Particularly, we look at an ESR, or a sedimentation rate, and the C-reactive protein, which are typically highly elevated. If you do see this and we are suspicious of this condition, immediate treatment with steroids is necessary to prevent this from occurring in the other eye. Also, what we typically do is we do a biopsy of the artery to confirm that it's inflamed. And the reason why this is important because treatment is long-term. This is something that needs to be treated over the course of years, not months. I have one slide here of what it actually looks like to have an inflamed artery. This is actually a pathologic slide, and you can see how the inside of this artery is very inflamed, and this is typical for arteritic anterior ischemic optic neuropathy. With either of these conditions, I typically do advocate getting an MRI just to ensure that there's nothing actually physically pushing on the optic nerve. Now, most commonly, the clinical presentation will say that there's probably not, but I still think that an MRI is prudent. Neither of these conditions would require having a lumbar puncture.